Hi, welcome everyone. We are excited to be with you today to share our presentation with you. We are elated to actually be presenting for the Institute for Healthcare Advancement, the 22nd Annual Health Literacy Conference. Our conference proposal is entitled Learner Perspectives on Health Literacy Education and Undergraduate Curriculum, a panel discussion. We are going to introduce ourselves in more detail on the next slide, but I did want to share. So I am Dr. Joyvina Evans. I serve as an assistant professor at Howard University, and I'm so excited to actually share this presentation with four amazing students in the undergraduate health management program at Howard University. So now we just want to briefly share introductions about ourselves, and then I'm going to share information in terms of the purpose of this presentation. Again, I serve as an assistant professor in the Department of Health Management at Howard University, specifically in the College of Nursing and Allied Health Sciences. I have a background in research, industry-sponsored clinical trials, clinical research, as well as academic research. And the first research project that I worked on was actually in health literacy when I was working at a hospital in Flint, Michigan. Now I'm going to turn it over to these four amazing panelists so that they can share a little bit of information about themselves in terms of their actual home state, their status in the actual health management program, and some of their plans after graduation. So I'm going to turn it over to Ms. Potts.
Hi, everyone. My name is Alicia Potts. I am a senior health management major at Howard University from Union, New Jersey. I will be graduating this May, and my plans post-graduation is I just signed a full-time offer with a big pharmaceutical company in which I'll be going back to New Jersey and starting my career with them. So I'm looking forward to that.
Thank you so much, Ms. Gwen.
Hello, everyone. My name is Taylor Gwynn. I am a graduating senior health management major and psychology minor from Latonia, Georgia. And my plans post-Howard is to attend Old Miss Law, where I hope to specialize in healthcare law and malpractice law.
Thank you so much. Ms. Hogan.
Hi, my name is Taylor Hogan. I'm a graduating senior health management major, political science minor from Nashville, Tennessee. And post-graduation, I plan to take a gap year where I want to get more experience working in the field in terms of learning more about community health.
Thank you so much. And then finally, Ms. Jackson.
Hello, everyone. My name is Karina Jackson, and I am a senior health management major from Manassas, Virginia. And after graduation, I will be attending the Medical College of Virginia for nursing school.
Thank you so much. So excited to share all of the panelists with you. And so we're going to go ahead and get started. We are going to have the objectives here by Ms. Potts.
Our first objective is to demonstrate ways to integrate health literacy into the curriculum to help learners improve health and well-being of their community. Our second objective is to learn about the health literacy knowledge and skills obtained from the panelists and how they plan to use it in the industry. And our last objective is to gain a deeper perspective on the importance of incorporating health literacy training into undergraduate health programs.
So since this is a health literacy conference, I believe all of us know a little bit about what health literacy is, but I still wanted to do just a very high level overview. So essentially, when we think about health literacy, we think about it being a possession of knowledge and literacy skills needed to make informed health related decisions. This goes beyond just within the hospital, but this actually includes the pharmacy, maneuvering through the pharmacy, maneuvering health insurance, which we know sometimes that can be a lot, actually taking medications, taking prescriptions, as well as even following doctor's orders, as an example. Health literacy is often linked to reading levels as well as literacy levels. And so while they tend to link together, it is important to know that they are fundamentally different than reading and writing. So again, there are some correlations between them, but it is fundamentally different. And again, the pinpoint, I'm going to say it that way, is that it is focused on health and health related decisions. Those with limited literacy, they tend to struggle with medication adherence, actually taking their medication, taking it the correct way. They tend to struggle with communicating with providers. This could be the physician, nurses, medical assistants, radiologists, specialists, as well as other techs. They tend to struggle with understanding diagnosis and actual treatment. And we've seen that there's increased ER visits. And so we know this from the literature. A lot of literature shares this information, as well as there's even literature within the Healthy People 2030 that actually shares the same information. And so this is why we know that it is a concern and that there is a need to ensure that we're improving the literacy levels of ourselves, but also of those that we serve. So when it comes to teaching health literacy to college students, we know that it's important for their own knowledge level. What tends to happen is when learners actually go off to college, they no longer have family members to assist them with their health or their medical needs. So now they are in a position where they have to actually maneuver through the healthcare system on their own. They're in a position where they have to learn to take those medications on their own and learn how to take it correctly. It's important for students in health and medical fields to understand and improve their own health literacy for themselves and their overall quality of life, but also in order for them to effectively help those that they're going to come in contact with when they graduate. So for instance, we've heard the panelists share, some of them are going into pharmaceutical companies. We have law school, we have nursing school, we have a gap year, but more specifically community health. And so in some way, all of them will have to deal with other individuals who may have limited or low literacy skills. In terms of incorporating health literacy into the course, so I currently teach health policy, health marketing, as well as health finance. And so within the health marketing course, I implemented a part of a lecture. It was not the full lecture, but a part of a lecture. I actually shared information about health literacy. And then a part of the lecture in the health policy, I shared about health literacy as well as health equity. And so some of the information that was shared is what is health literacy, what is limited health literacy, what are some of the complications of low or limited health literacy levels? And so with that, some of the information that was shared was from, I remember vividly, from an actual study from about 10 years or so ago, where there was actually a patient who was taking a fentanyl patch and ended up ODing or overdosing from this fentanyl patch. And what happened is the patient will put the patch on, and then when it was time, 4 to 6 hours or, as needed for pain, the patient will put another patch on. And then the patient had pain, will put another patch on. And what ended up happening is the patient never took the old patches off. So while that may be common for us, it was not common for that patient because the instructions said take or apply a patch as needed for pain, but the instruction never said to remove the old patch. And so we did talk about that, and then how to improve health literacy and how to share information with others so that they are able to fully understand what we are sharing with them from a healthcare standpoint. So this involved decreasing health medical jargon and using simple language and simple terms. This also includes sometimes even the teach back method, where we share information with patients or community members or loved ones, and then have them share it back with us to make sure that they fully understand and comprehend. So now we're going to jump into the learner perspectives, right? This is why we are here. So I am going to start with, and all of you feel free to jump in as you see fit to answer some of these questions. So with that being said, the first question is, what is your definition of health literacy? How do you interpret or understand the meaning of health literacy?
For me, I would say healthcare literacy is being able to have patients understand and process the health information that you're providing them so that they can make the best possible decision for themselves.
Yes, I would say is the ability to make informed decisions at all phases of your healthcare journey. I think a lot of people think that health literacy is just when you're talking face to face with your doctor, but it's actually, before you go to your doctor's office and after you visit with your doctor, are you able to make, wise decisions throughout the entire process of receiving healthcare?
Yeah, I would say it's more of like active listening. Like when you go to your provider, you're asking questions, you're listening to everything, and they might use a lot of big words. So sometimes it might be easy for it to go in one ear and out the other. But before you leave, making sure like you're not rushed out of the room and actually understanding what they're trying to get across, whether it's the diagnosis or the treatment plan. And then as well as, especially with social media and the use of Google, it's really easy for us to, go on Google when we're sick and everything pops up. It might say you're dying. It might say this, it might say that. But if you don't really understand the true, like, if you don't understand in smaller terms what's happening, you might really get lost. Okay, what's actually going on with my body?
Yeah, and I agree with what everyone said. I also think it's just like a unique way of communicating about our health.
Absolutely. Thank you all for sharing that. So I'm going to go to the next question. Why do you feel it's important to learn about health literacy in college? And this is specifically in general, but specifically since you all are in the health programs, have plans on furthering your education in health, whether it's health law, nursing, or working specifically in health, pharmaceutical, community health. Why is it important to learn about health literacy in college?
I would say because we are the next wave of professionals that are going to have to deal with health literacy. So on this panel, we have future nurses, we have people working for pharmaceutical companies and community health. So it's very important for us to understand health literacy because we're going to be directly dealing with it and advocating for different individuals, whether it's through healthcare law or, taking care of a patient in a hospital or, working with a pharmaceutical company doing outreach efforts. We're going to have other people's lives in our hands. So I think it's better to start early and get that knowledge so that we can make the best impact once we enter our professions.
Thank you.
Going along with what Taylor had said, I agree. I think not only is it like important for us in our career when we're reaching out to maybe different positions or reaching out to different communities, but as well as our families too. So if we know this information and they don't, it could always help someone especially because if they weren't studying science or they weren't a STEM major, they might not be aware of certain terms or certain things to look out for when going to the doctor. So just making sure overall, no matter what you choose to study in college, you're aware for you, for people you love, and just for people in general.
I agree, and I think just the way we learn about in school how to take care of someone, we also should learn how to communicate with who we're caring for.
I agree with everything that's been said. I think communication is very key in creating long-term solutions and giving people the tools they need to also prioritize themselves and their health of their community and their families.
Absolutely. Thank you all, for sharing that. And, the thing is that I really didn't learn that much about it myself in college. I wish I would have learned more about it. However, I will say when I was in high school, I had it was almost like a medical dictionary, encyclopedia type thing. And so I walked around learning stuff on my own and trying to figure out what was going on with me on my own. Almost like, I'm going to say like now, almost like the internet, but it was more like, let me use the dictionary and encyclopedia and all of that. And there were some concerns with that because there were times where, like Alicia, like you ended up mentioning, there were times where I actually was trying to diagnose myself, and I think I actually was just making myself a little more paranoid. So that's the one thing, is when we have the information, we have to make sure that we know what to do with the information. So you can read all this information online, but then do you know what to do with it? Do you know how to apply it? Is it making us more paranoid? Is it making us have more anxiety, because some people, when they think that some people may feel like, oh my gosh, something could happen to them, and I think I have cancer because my grandmother, my great grandmother, my mother, and whoever else had cancer, and it's not even that. So sometimes I feel like some information that we actually learn, that we know about, we actually end up making ourselves a little more paranoid. So it is helpful to have a better assessment of overall health literacy, know how to select correct information, accurate information, because we know there's a lot of fake and information out there, fake news and misinformation out there. And then also knowing when to actually go to a doctor, what to share with the doctor as well. Those all become extremely important. So then the next question that I have for you all is specifically, how will you incorporate health literacy into your future employment, whether that's the health industry or some other employment? How will you incorporate health literacy into your future employment?
As an inspiring pediatric nurse practitioner, I believe that healthcare literacy will be implemented in daily interactions with my future patients. And I think by having a solid foundation in this dialect can successfully articulate instructions, procedures, and diagnosis on all spectrums in much simpler terms for not only the patient's guardians, but also my younger patients who might be curious to what's going on.
In my future career, I wish to advocate for public health in Black and Brown communities and on a federal level. So I will use healthcare literacy through the power of policy to create institutional changes that can reduce healthcare spending overall, increase quality of life for Americans, and also create a more informed society.
And as a future healthcare attorney, specifically specializing in medical malpractice, I think I definitely will incorporate health literacy, because a lot of patients that I will represent will probably be suffering from, not having, not being fully having enough literacy as it relates to health. So I think that it'll be very important for me to learn about it and just make sure that I'm making sure that they understand what health literacy is, because a lot of medical malpractice cases do relate to, health literacy, the fact that no one knows how to advocate for themselves, and a lot of negligence can be stopped if patients, had the knowledge to advocate and speak up for themselves.
And in my future career, the pharmaceutical company that I'll be working for makes a lot of life-saving drugs for a lot of different diseases. So I'll be learning like a lot of new data, a lot of new research that are constantly going to be coming up. So I think learning about that in more depth, as well as learning like that health literacy aspect, will help me like communicate that more to everyone that I'll come in contact with, as well as they do have like, patient advocacy teams, as we spoke about earlier. And just going out, reaching out, joining one of those teams to connect to different communities and just spread the word about all the steps that'll help them like improve their health and things like that.
Yeah, thank you all for that. And Taylor, I do want to share in full disclosure. Some of this presentation actually stemmed from Taylor's interest in health literacy. And so there was a project, and so Taylor Gwen ended up sharing that she wanted to do her project on health literacy and specifically looking at medical malpractice as well. And so, one of the things I'll share in full disclosure about myself is, while I have a certain amount of education, I am a college professor, all of those different things, I actually had a major situation, as Taylor mentioned, in terms of advocacy. I had a situation where I was told to have a procedure that was unwarranted. And thankfully, because of the knowledge that I had, because of education, because of my health literacy levels and understanding of the different treatment options, I was able to advocate for myself. I was able to get a second opinion. I was able to read up on the literature in terms of my condition, my diagnosis, the treatment options, and I was able to preserve, I'll say it that way, I was able to preserve myself from having to go through a major surgery and having something that's very near and dear to me removed from my body because of the ability to advocate and because of the health literacy knowledge and understanding. So thank you all for that. So now I'm going to go ahead and share our next question. So with that being said, do you feel that there is a need for more education training on health literacy? Um, do you feel there's a need for more education training on health literacy? And if so, why or why not?
I would say yes. Personally, for me, I didn't really learn much about health literacy, or I didn't really take the time to investigate like what it fully, involves until I got to Dr. Evans' course. And so I think it's just very important because it can be a matter of life or death for a lot of individuals. And it's not anything to be taken lightly. Like you said, Dr. Evans, about your procedure. Fortunately, you were able to advocate for yourself, but there's so many other people in the world that don't have the opportunity to advocate for themselves, and they end up experiencing drastic complications. So it can definitely be a matter of life or death. So I think it's very important.
Thank you.
I think yes as well. Learning more information about health literacy is definitely helpful because everyone is a patient at some point, whether it's like a checkup or you're actually sick. And I think a lot of people, they might be a little scared to go to the doctor, or they might be nervous about what that may entail. But I feel like at the end of the day, it's your life, and I feel like preventative healthcare is so important. So just being knowledgeable on the steps that you need to take in order to remain healthy and stay healthy for you, for your family, is key, because you don't want anything to happen, or you don't want to have that late diagnosis when you could have went earlier and saved your life or saved someone else's life.
I
Um,
also, I'm sorry. I also agree that it is additional education would be very beneficial. I think that it would definitely strengthen the foundation for future healthcare professionals, but also like Taylor and Alicia said, when you can advocate for yourself, I think it would make a lot of things better health-wise.
Just to agree with everything that's said, I think having this training and education makes like understanding your health in the future less scary, because sometimes when you're thrown these words and you don't understand them, or even just trying to figure out insurance or whatever it may be, like having these skills already set and understanding early makes these challenges less hard when they come up.
Thank you. Thank you all for sharing and giving your perspective on that. So now I'm going to ask something for each of you. So Taylor, Gwen, you did end up touching on this. What was your knowledge before actually going away, going to college? What was your knowledge of health literacy? Like, did you understand? So like whether it was you, whether it's a loved one, did you understand, like if you were given a diagnosis, if somebody told you about a condition or a loved one about a condition, did you understand what it entailed, or the full what all goes into the healthcare system? So again, you have all these moving pieces, in healthcare. So even from a health management standpoint, you have the health marketing, you have the health policy, you have the health finance, you have the human resources side, you have, the leadership, components, you have all these different, components. Did you realize how So twofold. Number one, did you understand your literacy level before you actually got here? What was your understanding of your own health literacy level? Any conditions that you or your family members may have had? Did you feel like you were able to maneuver those situations?
Personally, my literacy level was very minimal. I didn't really fully understand anything other than what my physician told me. So, like you said, like there's a lot of different, components that goes into health literacy, such as policy and leadership and etc. However, for me, I didn't know those were components. The only component that I was aware of is what my physician told me. I just saw him as like the only component as it related to my healthcare. So whatever he or she told me, that's what I took to be true. I didn't know to like look into like the policy or the marketing aspect of health literacy. So it was very minimal coming into college. And even matriculating through college, it still was very minimum because I feel like it was more of a definition type of learning where you learned the definition of what it is, but you weren't really able to put it in context or in reality. So it's just more like here's the definition, and you don't really see how it takes shape in the real world.
Thank you for sharing a perspective.
I would say before going to college, I didn't have a strong background in health literacy. I agree with Taylor. I would know the definition, but not really like everything that's behind that, the diagnosis or anything. So my family used to call me the doctor of the family because I would look up everything on Google. But, as we all know, we can't just go based off of Google because there could be one symptom you put in, it could bring up so many other things. And I think that with health literacy, now that I'm older and I'm graduating, I have more of a stronger background in what something could mean and not go based off of, Google's diagnosis. So yeah, I would say before college, it wasn't strong, but being in Dr. Evans' classes and my other health management classes definitely gave me a strong background in health literacy.
I would say for me, before college, I feel like I kind of had a pretty like average level of health literacy. I used to always go like to the doctors with like my family members and things like growing up. And then they always stress the importance of, getting your checkups, getting this, getting that. And then as well, my mom works in a hospital. So I know like the administrative side of it and everything that goes into that as well. And then even in my internship last summer, I got to see like all the different departments that goes into healthcare and things like that. So I feel like I kind of had a good basis or understanding of what it was. And then like as I matriculated through college, it just continued to get stronger and build upon that.
Thank you.
I had a similar experience too, as my mom was always focused on making sure we had yearly physical exams. Like she always made sure we knew the importance of health and going to doctors regularly, dentists and all of that. But I would still say my health literacy didn't sort of increase until my mom got diagnosed with an autoimmune disease. And it was around the time I also started college. So I started being able to take the things that I was learning and sort of kind of contextualize it in a way that I can see how I can help people with it. Like I was able to see my mom's situation and how the healthcare system kind of functioned for her because she was having these problems for years, and it took until she was like in her 40s to finally get like the answer she needed. And then learning about more of the healthcare system throughout college. Sorry, I lost my point. Learning more about the healthcare system throughout college, I was kind of seeing the flaws and what more we could do.
Thank you. So Taylor Hogan, I want to piggyback off of that really fast. Since you mentioned your mom, how was it trying to maneuver through, the primary care physician, the specialist, because depending on, and I'm not asking you to share details, but depending on like autoimmune, it may have been like a rheumatologist, or like, other specialists, and then trying to get the insurance together, and then prescriptions, and then lab testing potentially. How was that, you and or your mom trying to get through all of those appointments, medication, just everything?
So I can speak more from my mom's part. She has been experiencing these issues like prior to even my brother and me being born, and she had gone to multiple different physicians. She had been given different information, and when I got older, like when I was in high school, that's when her condition started getting worse. And like back home, we're like our main hospital is Vanderbilt, so they were doing a lot, like having her go this way and that way, trying to find an answer. And then it finally like kind of clicked that it was an autoimmune disorder.
Thank you. Thank you for sharing that. And then Karina, you ended up mentioning in terms of, always Googling, right? And so I briefly touched on that earlier, how sometimes, you're looking up, and this is something that happened with me. I'm looking, and then my mom was the same way. And the next thing you know, it's like you've diagnosed yourself something that's totally wrong. So I'm just curious, and then I mentioned Karina, but this is for everyone. How many times, if at all, but have you ever been in a place where you were Googling for yourself or someone else, and you came up with, okay, this is what's going on, and it was completely opposite, potentially?
Oh, yes, for sure. So, especially with my grandparents, my grandma is my best friend. So even if she says, "Oh, her arthritis is acting up," I'm like, "No, let me Google this to see what's going on," and just crazy stuff comes up. I mean, I think Google is a good resource, but you can't always trust it, and that's why we have doctor's office, urgent care, hospitals for you to go in and really see what's going on. But yeah, it was plenty of times where I looked up something small or that said it was like really big and stuff like that. But yeah, I mean, Google is a good resource, especially with like hospitals like Mayo Clinic and stuff. They do have like a lot of information. So there's a lot of good resources, but I learned you can't always trust, the first thing that comes up on Google.
Absolutely. Thank you for sharing. Anyone else want to share something that you or a family member may have experienced?
I was just
Oh, go ahead. No, you're fine.
I was just gonna say, as like a first generation student, my family definitely thinks like I'm some type of like whiz and I have all the answers. They're like, "Taylor, you're in college, you know everything." I'm like, "No, I don't." So a lot of times, like I don't want to disappoint them, so I will go to Google myself to make it seem like I know. But yes, I definitely agree that, sometimes you just want to go to Google for, the fact that it's just convenient and you have a lot of people who are sometimes counting on you to have the answers that you don't have. So
So with that, so Karina mentioned her grandmother, and then Taylor, you mentioned being a first generation college student. And then Taylor Hogan, you mentioned in terms of, some conditions with your mom. And then Alicia, you mentioned an equity standpoint, at least earlier, you mentioned something in terms of equity. So when we think about from a health standpoint, some of the conditions that we tend to see, whether it's diabetes, hypertension, cardiovascular disease, cancer, whatever the case may be, and you think about health literacy, right? There's a disparity when you look at people who do have limited education, right? So again, you could have a master's, you could have an MBA and not really have the health knowledge, right? But you can obtain the information, you know where to obtain the information, you know how to obtain the information. But with someone who, let's just say, is low income college dropout, I'm sorry, high school dropout, excuse me, high school dropout, it may be a little more difficult for them to even comprehend taking medication or how to take medication. Or when someone is older, Karina, you mentioned, you know, your grandparents, when they're older, maybe they're starting to have some type of memory loss at some point, or a great grandparent or something. They're starting to have some type of memory loss. In addition to, I don't really remember what this pill is for or how many times I'm supposed to take this pill. Um, what can we do to help those individuals, whether it's to help increase their literacy levels or teach them? So, you know, Grandma, I know you don't know how to pronounce the name of this medication, right? Because we know some medications can go on and on. They seem, you know, really lengthy or really long. I know you may not know how to pronounce this medication, but we're going to call this medication RY, you know, or whatever the case may be. How can we actually help those individuals learn more about their health, learn more ways to actually take their medication, what their medication is for, what their diagnosis is? So what does it mean to have diabetes? What does it mean to have hypertension? How can we make sure, you know, you keep your stress level a little low? How can we actually help our loved ones and those in the community as a whole too?
I can actually share a personal experience with my grandfather. Unfortunately, he had, I believe, about 4 strokes, and shortly after, he started losing his memory. I was aware that he was losing his memory, but I felt like he started just showing signs of diabetes, you know, like when you don't have your insulin. And I had to have that conversation with him. He served in the military, so he thinks, you know, he doesn't need a doctor. He's okay. He was the breadwinner. So he just always thought he was okay. He's like, no, I'm okay. No, I'm okay. And I was just like, well, you know, it doesn't hurt going to the doctor. He kept telling me, no, it's okay. And I just had to respect his opinions, but also just keep, you know, trying to get him to just be seen by a doctor. And it's crazy because we actually found out he was diabetic. And I just think, like, if I just said, okay, you know, you don't have to go to the doctor, if I didn't, you know, advocate for my grandfather, I just think about what would have happened, you know, without right medication. So I think that respecting different generations, how they grew up, their normal everyday life, respecting that, but also just advocating for them and just saying, you know, it never hurts just to be seen is a good way to limit like a situation that happened with my grandfather.
Thank you. Anyone else want to share?
I agree with Karina's point. I do think it's important to sort of like when you're trying to tell this information and meet people where they're at, and sort of like don't try to be too pushy, because that's when you're going to get that resistance and not wanting to take in the information that you're giving. But coming to them from a place of understanding and care is the best way.
Yeah, I agree. I think sometimes respecting, like Karina said, like what generational, different generations have different mindsets and things like that. So I think sometimes, especially like our grandparents' age, they might be a little bit hesitant to go to the doctor, but it's like you don't want to be too pushy because then they're definitely not going to want to do it. But at the same time, you kind of have to like tell them like, hey, I need you here. I need you to get this checked out. I need you to do this so you can be in my life and things like that for the long run. And I feel like once you kind of use that emotional tactic, it might work a little bit better. And they'll just be more open to seeing the doctor. And just seeing them, I feel like is the first step. Who knows what they're going to do after they leave and the tips that the doctor tells them to do. But I feel like just seeing them and having them be open to at least trying to get checked out is a good stepping stone.
Yes, I agree with everyone. I also think that it should start with the physicians and nurses to make sure before that before they discharge a patient that the patient fully understands all the implications of their health. For example, my mother is a diabetic. So when she got home, she used to like come to us and say like I'm bruising easily or like the bottom of my feet are changing. And we were like, that's because that's a symptom of your, having diabetes, but she didn't know that. And so my mind went to like they didn't tell you any like the symptoms to expect before they discharge you or signs that you should be aware of or things that you might experience as a type 2 diabetic. So I just think that is very important for physicians and nurses and whoever is taking care of the patient to make sure that before the patient leaves, they have a good understanding of like what their health is going to involve for the next stages of their life.
Thank you for that, Taylor. And that's a really good point as it pertains to, so going back to making sure we incorporate health literacy into the curriculum, right? So that all the future, whether it's future medical students, future nurses, future physician assistants, future community health workers, public health workers, future health administrators, all of that, respiratory therapists, ultrasound techs, like everyone, medical assistants, like I'm trying to figure out everyone, but like everyone is aware of their role. So when you think about from a healthcare perspective, all of us actually have a role. And so like Taylor said, it's important to make sure that we know the information, that we know our health literacy levels, that we know what health literacy is, that we know how to teach others, as well. And so again, it just goes back to the importance of making sure that we are teaching health literacy at the undergraduate levels and at graduate levels, and that we are teaching it. I would say even I would dare to say that there may be an opportunity for a full course on health literacy, health equity, health disparities, sort of, putting them in some form of a course together so that it is more than 30 minutes or more than an hour. I think this is something that's so important because, again, going back to what we saw and what the literature shows, there's an increase of medication errors. And so, and Taylor mentioned like what she wants to do. She wants to go to law school to look at, to study healthcare law, specifically malpractice. There are a lot of malpractice situations, because of, excuse me, some of it is because of something that a provider has done or something that has happened at a healthcare organization, but then some of it may be negligence because of lack of educating the patient, right? And so that's something that we need to consider. And Taylor, I'll share with you on a personal note, and actually with everyone. So I have a history of iron deficiency anemia. And so with that, a lot of times my digits, my hands and feet are really cold. And with that, there's an increase of bruising as well. There is fatigue that can come with that. But then there's something called pica. And that's where you tend to eat. I'm going to say eat. My thing was ice. So I had a major like addicted to chewing ice, like literally eating ice and chewing ice. And so I'm not saying this about everyone who chews ice, because some people may just like to chew ice. But for myself, that was when I knew that something was going on. It's really I want to say it's more of like a craving for non-nutritional substances. So I did have a former colleague where she suffered from iron deficiency anemia. She did have pica along with hers, and she actually craved dirt. That was her thing. So she was dirt, I was ice. And I was grateful that I was ice when I found out that she was dirt, right? And so eventually her provider ended up saying, well, you know what? We don't want you eating dirt. Okay, well, first of all, we need to correct your iron. We don't want you eating dirt. Why don't you look at cream of wheat or cocoa wheat? Because it has the consistency of like dirt. And so she started eating, she said she started eating a lot of like cream of wheat, cocoa wheat, but she ate so much, she started gaining a lot of weight. So now she's eating all of this, cream of wheat, cocoa wheat, she started gaining all this weight, and then it started leading to other health conditions. So with myself, what ended up happening, I had it since I was little, but then when I got older, it's like, okay, what's going on? Why is your iron continuing to drop? How are your cycles? So then there was the conversation. So Taylor, going back to, let's have these conversations. Let's see what's going on. How are your cycles? Are they heavier? Yes, they have gotten a little heavier than normal. Okay. Well, how often, how many pads would you say that you go through? So then there's again more conversation. So then there was a pelvic exam. And then they found out that the iron, the drop in the iron was being caused at this particular stage of my life was being caused because the heavy cycles. Well, what was causing the heavy cycles? The heavy cycles were being caused because of uterine fibroids. So when I ended up having a surgery to remove the fibroids, that actually corrected the heavy cycle, which corrected the iron. So again, it's one of those things where we have to ensure that we are having the conversation with our doctor, that we as patients, we as family advocates, so if we're going to the doctor with our loved ones, making sure that if we're there and they said something incorrect, that we're jumping in. Wait, grandma, wait, mama, wait, dad. You said last time that you actually was having trouble keeping items down, that you were vomiting. We have to make sure that we're actually stepping in and sharing that. So because sometimes the providers can't help us, they don't know everything. We haven't shared the full story. So we have to make sure that we're being open, that we're sharing information, that we're being transparent, and also as providers that we are properly explaining information. Like Taylor said, you're explaining the diagnosis, you're explaining symptoms, you're explaining some of the treatment options, whether it's wait and see, whether it's a medication, you're explaining the side effects of the medication, because we know all medications have a side effect, right? So we're explaining the side effect of the medication, and we're also explaining when to come back in. So if you're having any complications, here are the risks of the medication. This is when you should actually come back in. So all of that is extremely important. So with that being said, I'm just going to end with one last question. What is something that you want the audience to know? One last minute thing that you want to share with the audience in terms of the importance of teaching about health literacy, teaching the next generation of, again, nurses, doctors, health management, community health, public health individuals, teaching them about health literacy and how to properly educate, share information with their patients and everyone that they come in contact with. And just everyone, if you could just share a last minute takeaway, that would be great.
I would say that health literacy is literally like the best way to advocate for your health and the health of your loved ones. No matter if you're a criminal justice major, if you're political science, nursing, whatever your major is, at some point you're going to have to advocate for your health or maybe the health of a loved one. So it's best to learn, what health literacy is and how it can apply to your life, because you don't want to be in a position where you don't know what to do because you didn't seize the opportunity to learn about health literacy in college, where you have like a lot of access to professors who are sometimes doctors who work in public health. So seize the opportunity while you're in college and learn from your environment, because one day you might end up in a situation where you need to advocate for yourself.
Thank you.
Yeah, I think knowing health literacy, just knowing like not specifically medical terminology, but it kind of goes like hand in hand in a way, is very important. I think when you go to different providers, or let's say you have like an illness and you have to see a specialist, it's okay to get different opinions. You don't have to stick to one provider because they might not know what's best for you. And you might find a provider that better suits your needs, better understands what's going on, and can actually provide a better treatment plan for you. Because like you mentioned before, how one doctor wanted you to have surgery while another one found a better treatment plan for you. You just never know. And because if you didn't know like certain terminology or certain health literacy terms, then you might have just went with the first thing that you heard and said, okay, I need to have surgery, and that would have been it. But because you had autonomy over your own health, because you were actively listening, because you were asking these hard questions that doctors most likely probably don't want to hear all the time because they want to be in and out, you got the best treatment that you deserve for your body and your health. So I think that's just a key takeaway that I would say for everyone to do, and not just go with the first thing you see or the first thing you hear, because it's very important just to get different opinions and just different outlooks on anything.
Thank you.
I agree. And I also believe that you can never learn too much. There's always something new to learn. So whether you're learning about health literacy for your education or job, or just learning it for your own personal health, I think that there's no con to health literacy. Like it will always help you. So the more you learn, I think the better.
Thank you.
I would just say having the opportunity to learn more about health literacy through my courses with Dr. Evans has been really great. It's helping me kind of think more about how I want to enact change in the future and how I want to use like what I've learned to sort of help others as well.
Thank you. So thank you all. Thanks to all of the panelists. We definitely appreciate you. I'm glad that we were able to share this information. And the last thing I want to share is if you are an instructor seeking to incorporate health literacy into your course, one thing to consider. So one of the things I did in the health marketing course, I believe it's two of you that was in the health marketing course, is there was an assignment. They had to actually create a commercial for a new cardiovascular center. And within that particular assignment, they had to consider the health literacy level of the community. I did share with them the demographic, and that demographic indicated that the community did have limited literacy. So when they were creating the commercial, they had to consider the limited literacy levels of the community. They had to ensure that they were using information that the community will understand and that it was easy to understand. So you can consider sharing and teaching about health literacy. What is it? And then incorporating it into your assignments. Also, as providers, as we are teaching the students, and as the students are going out into the field, always knowing to operate with the spirit of grace, being understanding that people don't know. They may not have the same literacy level as health literacy levels as us, and being patient with them, taking the time, as Taylor Gwynn mentioned earlier, taking the time to explain to them their condition, and allowing them to ask questions. If there is a provider who does not allow that, then maybe it's time to select a different provider. If there's a provider that is trying to rush you and cannot clearly explain your condition, your treatment options, different risks, then maybe it's time for a new provider. So with that being said, I think all of us have shared the importance of health literacy, why it is necessary to incorporate it into the curriculum, why it is necessary for the future health professionals, and why we all are going to do our part to ensure that we are educating ourselves and educating those that we come in contact with. Thank you all so much. Feel free, if you have any questions, feel free to reach out to any of us. All of us are at Howard University in Washington, D.C. We are grateful for this opportunity. Thanks so much, everyone.